good morning. My name is Robin Chisdava. Today I'm gonna perform insertion of Foley catheter. This is my school ID. This is my uniform, but it's not the school uniform because I didn't receive it yet. This is my sterile kit, and this is my patient hand sanitizer and my plastic bag. And then first I'm gonna knock on the door to introduce myself to my patient. Knock, 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 knock. I'm gonna close the curtain behind me. Hi, good morning. My name is Robin Chisdava. Today I'm gonna be your nurse. Please can I have your first and last name and your date of birth? Can I check your waistband? Okay, today I'm gonna insert the Foley catheter for you. Is that okay with you? Okay, first I'm gonna wash my hand and apply a clean glove. I'll be right back. Wash my hand with hand sanitizer, and then now I'm gonna apply a clean glove. Okay, Mrs. Smith, today the doctor has ordered a placement of a Foley catheter. This is a tube is going to sit in your bladder to drain urine out. Is that okay with you if I place it for you today? Okay, Mrs. Smith, I got my patient consent. Now I'm gonna clean the area. I'm gonna use my washcloth with some no soap and water. After that, I will walk to the catheter. Okay, Mrs. Smith, this is my right hand, and then this is my patient right side. And then, Mrs. Smith, you're gonna feel my hand touching you. Okay? Can you bend your knee for me, please? Okay? Can you bend like a butterfly? Okay, thank you. You're gonna feel my hand touching you, Mrs. Smith. I'm gonna open the labia. I'm gonna wash from the top to the bottom, anterior to posterior, and then in the middle part. I'm gonna fold it. Now I'm gonna clean the middle part. Trash. Now I'm gonna dry it the same way, anterior to posterior, and from the top to the bottom, and then in the middle part. I'm gonna dry it, fold it, dry it again. I'm gonna fold it. I'm gonna dry the middle part all the way down the center. Okay, Mrs. Smith, now I'm gonna check your anatomy. I'm gonna check your meatus. Now I see your meatus is open. I'm gonna assess if there is any discoloration, discharge, odor, and smell. Okay, Mrs. Smith. Now I'm gonna remove my gloves. Turn it inside out. Trash. I'm gonna sanitize my hand again. Okay, Mrs. Smith, now I'm gonna go to the sterility part. I'm gonna put the catheter between your leg. Please don't touch it during the procedure. Now I'm gonna open my sterile kit. I sanitize my hand again. I'm gonna open it, touch only 1 inch margin. I'm gonna use 2 fingers to take my gloves out. Now I'm gonna open my gloves. Now I'm gonna use 2 fingers to put my gloves on. I'm gonna use the other one to put my gloves on. I'm gonna make sure it doesn't roll up my waist. I'm gonna move here, a little bit here, I touch only in the middle part. Now I'm gonna pull up my tray. I'm gonna put the shiny part on the bottom. I'm gonna move it a little bit here with my hand. Mrs. Smith, can you lift your hip up for me? I'm gonna put my tray. I'm gonna use the other tray. Tray is already used because of practice. I'm gonna put it there. Okay, Mrs. Smith. Now I'm gonna open my alcohol. This is my clean hand, dirty hand gonna be here. Trash. Now I'm gonna move my zero kit a little bit closer. I'm gonna put a little bit lubricate and then trash. Now I'm gonna loop the type. Trash. Now I'm gonna attach the syringe. Now I'm gonna take off the plastic, the wrapper. I put it in the trash. I'm gonna put my kit a little bit closer. Now I'm gonna start cleaning. Okay, Mrs. Smith, you're gonna feel my hand touching you, okay? I'm gonna start cleaning from the top to the bottom, anterior to posterior, and the middle part. My hand gonna touch on you. I'm gonna clean. And then in the middle area also. Trash. Trash. And then I'm gonna clean the middle area. All the way down the center. Trash. Okay, Mrs. Smith, I'm gonna move my stereo kit a little bit closer. I'm gonna move this one here to move my stereo kit a little bit closer. Okay, Mrs. Smith, now I'm gonna insert the catheter 2 to 3 inches. Can you take a 90 breath for me, please? I'm gonna open the labia. Take a 90 breath for me, Mrs. Smith. I'm gonna make sure to secure the tube. I'm gonna move my hand a little bit down here. I'm gonna roll it. Okay, now I'm gonna inflate my 10 cc with fluid. Until I meet resistance. Okay, Mrs. Smith, I inflate all my 10 cc. I'm gonna make sure until I meet resistance, the tube is secure, I meet resistance. Now I'm gonna take off the syringe and put it in the trash. Okay, Mrs. Smith, now I'm gonna clean everything. I'm gonna put the catheter. I use my 2 hands now on Mrs. Smith's bed. I'm gonna hang up here, and then I'm gonna move my little bit here. I'm gonna put Mrs. Smith back here. Okay, now I'm gonna clean I'm gonna dry up Mrs. Smith. Garbage. Now I'm gonna clean everything. Now I'm gonna remove my gloves, turn it inside out. 2 fingers, turn it inside out. Now I'm gonna sanitize my hand. I'm gonna make sure my patient is on position comfortable. Mrs. Smith, if you feel any discomfort, please let me know. And then I'm gonna come back to check on your drainage. And then if you have any questions, please. Okay, Mrs. Smith, I'm gonna record my procedure. I'm gonna leave, give my patient privacy and leave. Thank you.